Welcome everybody to MoRat Nation. I'm Bob Carmichael and let's get started. To begin with, I should mention that I am not a doctor and that these are my personal views and are not intended as medical advice. Best ways to naturally raise testosterone, which I think is a bad idea. I'm sure most of us have seen advertisements where a big, strong, famous athlete with a beautiful woman holding him by the arm endorses a testosterone-boosting product that really made a big difference for him. Then you see a scene where he's lifting weights or doing something athletic. Then he turns to the camera and gives you a big wink. And he tells you that all you have to do to be like him is take this bottle of pills and your testosterone levels will magically rise. Ask any menopausal woman, and she will tell you that getting her hormones in balance is a very hard thing to do, and the same is true for men. The truth is, just focusing on hormones like testosterone, instead of trying to balance all of the different hormones that react with testosterone, is just plain dangerous and stupid. So I guess the first question is, does taking these pills raise testosterone? Most of the time, no. But some of the products, at least for a short period of time, do raise testosterone. There are 3 ways to raise testosterone without adding the actual hormone. The first way is to use aromatase inhibitors. They prevent testosterone from being converted to estrogen by the aromatase enzyme. The most common drug is Arimidex. It's used by doctors to treat certain types of hormone-related cancers, but some doctors use it to balance estrogen and testosterone in older men. The mineral zinc is a mild aromatase inhibitor that is sometimes combined with magnesium. Luteinizing hormone boosters, such as human chorionic gonadotropin, or HCG, D-aspartic acid, is a supplement found in many health food stores. Chasteberry is an herb also found in health food stores. And small amounts of testosterone are made in the adrenal glands. Hormones like DHEA and adaptogens like Panax, ginseng, or rhodiola rosea can sometimes raise levels a small amount. My 2 personal experiences with raising testosterone naturally. 20 years ago, I decided based on something I read online that my testosterone should be 20 times higher than my estradiol. So I started taking a product called ZMA, zinc with magnesium. The next month I had my blood tested for hormone levels, and I was shocked to find that my DHT, dihydrotestosterone, had nearly tripled. 2 years ago, my wife and I were having trouble sleeping, so we began to try a variety of different solutions that we saw online or on YouTube videos. One TV doctor highly recommended progesterone, 50 milligrams of cream rubbed onto our arms just before bed. The next week I had my blood tested, and I was shocked to see that my testosterone levels went up from 700 to 1300. I had no idea that progesterone would have this kind of effect. My doctor looked at me very suspiciously when I got the results. I'm sure he thought I was taking anabolic steroids on the side. These experiences tell me that just taking an over-the-counter supplement or a hormone can give you very unpredictable results. Some of you men are in your 40s and 50s and are new to testosterone replacement therapy. And the results I'm talking about here might seem to be something that you want. But testosterone replacement therapy is something that happens over many years. And you have to ask the question, is it a good idea to take an over-the-counter supplement for several years without having any idea what the long-term effects and side effects might be? I think it's a much better idea to work with a doctor and have him prescribe the necessary testosterone and then follow up with a blood test. I think you're much less likely to get yourself into trouble taking this approach. Testosterone risks and side effects. Many doctors view testosterone the same way they view plastic surgery. It's medical, but not really that necessary for good health. Doctors are watched to make sure they are not prescribing testosterone in an unsafe amount or for inappropriate reasons, such as for high school athletes. Testosterone can have a number of dangerous side effects. Some studies show an increased risk of heart disease and stroke. Donating blood greatly reduces this risk. All steroids put a heavy load on the kidneys. A good doctor will check your creatinine and GFR levels to make sure your body can handle the dose you are on. If you lift weights, your creatinine levels will be higher than normal. You should ask your doctor for a cystatin C test instead of the standard creatinine test that is used to estimate kidney filtration rates on the standard panel. This is a much more accurate way of measuring GFR. The reason most men don't do TRT, or testosterone replacement therapy, is the risk of prostate cancer. If you have an old doctor, he was taught high testosterone causes prostate cancer. Low testosterone will protect you from prostate cancer, and giving testosterone to a man with prostate cancer is like throwing gas on a fire. Surprisingly, none of these statements are considered true today. The other two side effects that men worry about, BPH, or enlarged prostate, and hair loss. Enlarged prostate. The number one cause is not testosterone, but insulin. If you have high insulin, the most important step in reducing BPH is to lower insulin levels. No sugar or grain products and no low-fat dairy, only high-fat dairy. There are drugs like finasteride and supplements like Supplemento that lower DHT. They help with symptoms by blocking the 5-alpha reductase enzyme that converts testosterone to DHT or dihydrotestosterone. Hair loss or male pattern baldness. Men have androgens that are released from sweat glands on top of their head that attach to hair follicles. These androgens, testosterone and DHT, cause low levels of inflammation, which the immune system mistakes for infection. The more androgen receptors on the hair follicles, the greater the chance of hair loss. This is why some men are more susceptible genetically to hair loss than others. I plan on making several other videos about testosterone replacement therapy, so please click on the playlist at the end of this video and subscribe to Mole Rat Nation. I have no financial ties with any of the products mentioned in this video. And thanks for watching.